But welcome everybody to tonight's session with Dr. Baritz. This is Christine Rabel, the rep in Connecticut. Ben has a previous engagement this evening, so he can't jump on, and I think Keith is also occupied with something. So anyway, so I will be here. I will check the Q&A and the chat box and see if anything comes in. And I think that's about it. You can take it away, Dr. Baritz.
Thanks, Christine.
You're welcome.
Hi, so today's workshop is going to be on how to relieve stress and anxiety. It seems we can't escape stress and the accompanying anxiousness. Finance, work, health, relationships, obligations, politics, security, and other issues can be sources of stress. And any one of these things, or any one of these feelings of stress can cause anxiety. In this workshop, I'm going to show you how to use 3 acupuncture points to help your patients feel better fast. These points have been helping people manage stress for thousands of years. It is believed that these points work by reducing nervous system overload. I will also give you my top picks for dietary supplements that have been helping people for decades. Just to talk about stress for a minute, Hans Zellier, the famous doctor who invented the word stress in terms of an emotional feeling, and he created what's called all the data on the stress response and adrenal exhaustion. He created all of that, and when he was interviewed talking about stress, he said, "Life is stress, and when there is no stress, a person is dead." And so he pointed out that it's not a target to avoid all stress, because you avoid all living. The target is simply to look for the stresses that you want to have rather than the stresses you don't want to have, and to manage your body and the stresses in such a way that it's sort of a good and helpful stress, because stress does keep you awake and alert and keeps you productive. So he coined a term called eustress, meaning good stress. However, that never really caught on. But I think the concept that we're not trying to avoid stress, we simply want to manage unpleasant stresses, and we want to direct ourselves and our patients to those stresses that are more pleasant. So let's take a look here now. Stress can be defined as any type of change that causes physical, emotional, or physiological strain. Stress is your body's response to anything that requires attention or action. Everyone experiences stress to some degree. It's a shortening of the Middle English distress, and it comes from the Latin strictus, tight, compressed, or draw together. And you'll see in a minute when we take a look at the definition of anxiety, this Latin root of tight and compressed is also shown. So when you get that tight feeling in your chest, or a person gets a tight feeling in their throat, that's what the word describes. That's how the whole term came about. Let's take a look at the definition of anxiety. And anxiety is defined as a feeling of worry, nervousness, or unease, typically about some imminent event or something with an uncertain outcome. I was anxious about the results of my test. I was anxious about going in for the interview. And it comes from the Latin agere, to choke, plus OUS. Very interesting. And what I've prepared for you is this handout that you can give or send to your email to your patients. And this is the how to locate the acupuncture points, anterior, posterior, what is the human inch or the Soon, just to help your patients understand. And then here are the stress and anxiety points that we're going to cover in our video. And as you can see, Heart 7, which we spoke about in the last webinar. Maybe Dr. Fernandez mentioned it. Spirit Gate, and there's Conception Vessel 12, Center Chest, and Yin Tang, which we'll go over in more detail. And then over here are the stress and anxiety supplements. I picked the 4 top supplements that I think will help. And then I gave an also consider section with the reasons why. For example, if a person has upset stomachs, then Enzicor is the deal. If there's any type of hormonal imbalance, then it's Simplex F or Simplex M. If there's any sort of obsession or compulsions, then that beautiful Inositol powder, which I took for almost a year. And Cataplex B Core, which is really what they call a nervine, but in normal speak, it's a nerve tonic. And Cataplex B6 for energy, and Gotocoda Complex for inflammation, which of course, when things are inflamed, you tend to feel stressed or anxious. Over here, I've added different lifestyle recommendations and regular exercise, a daily contact with pets, working with animals, gardening, and or caring for house plants, and reduce exposure to EMF, electromagnetic frequencies, and we'll cover that more in just a few moments. And here's the medical disclaimer. So I've created 4 courses. Each course takes anywhere from 3 to 4 weeks to complete, and they sell online for $190. And these are really resources for your patients because it actually trains a person how to use these points. It's not just showing them the points, but it's a full training protocol with full downloads and full standard process and other nutritional products. So I've set this up so you can be my affiliate, and if you refer a person to this, or this is on your website or in your Facebook post, and people click on the link there to get to my website, then we're going to tag them as your referee, and we will give you 20% of any courses they buy, not only at the time, but also for the next 365 days, no matter how they get to my website. And then for the holiday season, I'm also going to give my book, Introduction to Acupuncture, How and Why It Works. This book does sell it for $25, but as my holiday special for your patients, we're going to give this free with any purchase of a course. Okay, so here's the first supplement, Orchex, three times a day. This is one of my most favorite subject in products, and it's a very powerful one. Sometimes, now the dose is three times a day, but some patients may only be able to take 1 or 2 of them. It has a potent calming effect that helps maintain an emotional balance. It encourages mental clarity. It enhances the ability to relax. It allows greater adaptability to life stresses. So again, we're not trying to avoid stresses, but can we adapt to these stresses so we can turn them to productivity? It supports balanced function of the nervous system, and it supports healthy testicular function because it includes bull testicle extract, which has some amazing properties we could cover in another video. The next product I love is a Neuroplex. The dose is 3 twice a day. This is suggested on an empty stomach. It supports the nervous system, supports cognitive functioning. That means alertness and thinking. And it contains a broad spectrum of vitamins, minerals, and complementary animal tissues to support endocrine organ function. Next, we have ProtoFood 3 twice a day. This supports cellular health, promotes healthy protein metabolism. It contains 8 essential amino acids and ribonucleic acid to support protein metabolism and to support body growth and repair. Now, among the amino acids, so as you know, an essential amino acid is an amino acid that your body cannot create itself. And so it's essential. That means you have to consume it. Now, tryptophan is an essential amino acid. And as you know, tryptophan is important for sleep. And so when people, are having trouble sleeping, they're often be taking tryptophan supplements. However, when they take a tryptophan supplement, it bypasses the normal metabolic process, and therefore it doesn't work as well as if they're actually eating a source of tryptophan, like a turkey or ProtoFood. And tryptophan is an amino acid that's an important a precursor for the production of serotonin. We've all heard plenty about serotonin and how that that neurotransmitter is helpful for patients. So this is a very potent product. Dr. Royal Lee originally recommended only once a day, and for some patients, only once a week. But when you have a patient, they're already anxious and distressed, we're going to give them heavy. We're coming in hot and we're coming in heavy. Twice a day. We want to knock this stress and anxiety down. We want to get them on a more positive route. We want them feeling better quick. That's why I suggest a heavy dose, and then you can back it off way back down, maybe as little as one a day, or maybe for some patients, even as little as one a week. Okay, Easy Mag. This is a product, I think it came out maybe last year, and it was another, brilliant standard process product using this plant-based magnesium in this very dissolvable way. If you haven't tried it, just get a box for yourself, open it up, drink it down, and, with me, almost within the minute, certainly within 10 minutes, I'm feeling brighter. And I think you will too. I suggest get a pack of it for yourself, try it, have your staff try it, have your spouse, your significant other try it. If you got kids, give it to them. This product will not disappoint. So plant-based, naturally occurring magnesium. It's essential for utilization of calcium, central nervous system support, that's the brain and the spinal cord, neuromuscular support, and cardiovascular system support. Okay, also consider, so that's the basic protocol. Also consider Enzicor 2 with each meal. So if a person has any signs of digestive disturbances, they're getting acid reflux, they're getting butterflies in their stomach when they're worrying about something, their stomach is churning, they get gas, they get bloating, they get a stomach ache, they get constipation, they get diarrhea, then you want to add this to their protocol. It's a complex blend of enzymes, glutamine, and other whole food ingredients designed to support healthy digestion and maximize nutrient absorption. This glutamine, which is the L-glutamine, which means it's the natural version, is an amino acid that helps to thicken the lining of the intestines, thereby reducing leaky gut and improving mood. Okay, next product, a Simplex FRM 6 a day on an empty stomach. This is for hormonal balance. So if the person shows any sign of hormonal imbalance, a woman is having premenopause issues, she's having menopause issues, there's menstrual complaints, somebody is trying to get pregnant, somebody has just completed a pregnancy, PMS, if a man is having anything that he believes is a hormonal issue, quote unquote low T, this product is a home run. It supports the pituitary gland, the thyroid gland, the adrenal glands, and the ovaries or the testicles. This is one of the 3 products that I give every patient when they come in my office. You can't lose with this product. And then Inositol powder, 1 tablespoon 3 times a day. This is for obsessions or compulsions. So the PhD, Gina L. Nick, she wrote this wonderful article on inositol powder, and I'm going to quote from her now. Clinical research studies indicate that inositol is an effective, safe alternative to antidepressant medications, particularly selective serotonin reuptake inhibitors and tricyclic antidepressants, for the management and treatment of depression, panic disorders, and obsessive compulsive disorders, OCD. Inositol's efficacy and its absence of side effects makes this nutrient an attractive addition to treatment plans for specific mood disorders. So these aren't my words, these are the words of the person who actually did the research. Now, for depression and panic, the literature generally suggests a dose of 12 grams, which is 3 tablespoons of inositol per day. As little as 1 to 2 teaspoons can be used to promote sleep. Normally, the dose starts at 1 tablespoon and is titrated up to 3 tablespoons. So You start with 1 tablespoon. If that person says, okay, they're feeling better, they're feeling less compulsive, then that's their dose. If not, after a day or 2, you go to 2 and then up to 3. And so that's how you bring it up. Not everyone will need the 3 tablespoons. And some people, if they get more inositol than they need, they'll develop loose bowels. So you want to take it, and that's not a big deal. You just back it off. It just means the body doesn't need it and it's shedding it. So now this product tastes sweet, and the sweeter it tastes, the more you need it or the more your patient needs it. Cataplex B Core. This is the Nervine or nerve tonic, 2 twice a day. Supports heart health, palpitations, tachycardia, blood sugar balance, low blood sugar, supports muscle strength, poor muscle tone, supports mood, and for depression and anxiety. Okay, niacinamide B6, 3 twice a day. This is for energy production, supports nervous system health, supports energy metabolism, supports cellular metabolic processes. And you know something? If a person is low energy, they may believe they're depressed. They're not depressed. They just have low energy. Try B6 and see if it doesn't work for your patient. Now we have Gotu-Kotu Complex, 2 twice a day. This is for inflammation. So anxiety causes inflammation, and inflammation causes anxiety. So anything we can do to knock down inflammation, if a person has it, this is the product. Supports the body's ability to adapt to temporary stress, promotes healthy blood circulation, provides antioxidant activity, and promotes healing. And now support the individual, regular exercise, daily contact with pets, working with animals, gardening, and or caring for house plants. You're dealing with live things, you're taking care of live things, and this is a great stress reducer, especially plants and animals that aren't as critical as some people we know. And then reduce exposure to television, computers, Wi-Fi, and other electronics. And I say as much as possible because it's everywhere. But if you can reduce it somewhat, so much the better. Now, here's our video today. How to use acupuncture points to relieve stress and anxiety.
Hello. In the next few minutes, I'm going to show you how to use 3 acupuncture points to get rapid release from stress and anxiety. It seems we can't escape stress. Finances, work, health, relationships, obligations, politics, security, and other issues can be sources of stress. Any one of these can cause feelings of stress and anxiety. I'm going to show you how to use 3 acupuncture points to feel better fast. These points have been helping people manage stress for thousands of years. It is believed that these points work by reducing nervous system overload. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live healthier and happier lives, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The easiest and most convenient point to relieve stress and anxiety is Heart 7. Heart 7 is known as Spirit Gate. In addition to promoting relaxation, Heart 7 is used to help with chest pain, irritation, poor memory, and rapid heartbeat. In Asia, Heart 7 has been used to help persons with autism. To find Heart 7, look at the palm of your hand. Notice there's a crease right at the wrist point. There may be a couple of creases. If there are, just pick the crease that's closest to your palm. Follow along the crease until you reach the pinky side. Right at the end of the crease, if you push in, there'll be a tender spot there. It might be slightly higher, slightly to left or right, or slightly lower. But there will be a spot that is a little bit more tender. That's Heart 7. This point is best stimulated by tapping with your finger or with the round end invitation if you have one. It might look like this. Or remember, this point is stimulated with a gentle tapping, which should not be painful or unpleasant. Tap rapidly 5 times, rest for a count of 5, then repeat 4 more times. Now find heart 7 on your other hand and repeat. During or shortly after stimulating heart 7, you may notice a sensation of heat or energy in your hand, arm, head, or face. This is normal and temporary. After stimulating heart 7, take a few deep breaths and see if you don't notice some heat in your face or ears. The next point that I recommend to relieve stress is conception vessel 17. Now there's a difference between an acupuncture meridian, which is a line running this way on the body, and a vessel. You can think of a meridian like a river or stream that transports energy or chi from one area of the body to another to achieve harmony. You can think of a vessel like a lake or a reservoir. Acupuncture vessels are said to collect, conserve, and increase vital energy. Activating conception vessel 17 helps build and restore your internal energy. Conception vessel 17 is known as center chest, and in addition to treating stress, it is used to help with heart palpitations, chest pains, asthma, insufficient lactation, and to soothe breathing difficulties. Conception vessel 17 is located at the midline of your chest between your nipples or where your nipples used to be. Press into this area and find a spot that is sensitive, tender, or painful. That is conception vessel 17. Conception vessel 17 is stimulated by rubbing or pulsing on it 5 times rapidly, taking a break for a count of 5, and repeating 4 more times. If you use your finger, it might look like this. If you use a Tei Shin, it might look like this. After stimulating conception vessel 17, you may notice a sensation of heat or energy in your head, chest, or pelvis. This is normal and temporary. Yin Tang is the third and perhaps most powerful acupuncture point for stress and anxiety. Yin Tang is known as the Hall of Impressions. In addition to treating stress, Yin Tang is used to reduce eye strain, headaches, and sinus issues. Yin Tang has been used to reduce all types of pain and improve upper body strength. Yin Tang is located between the inner ends of the eyebrows on a bony prominence called the glabella. Yin Tang is best treated with a gentle tapping motion. Tap rapidly 5 times, take a break for a count of 5, and repeat 4 more times, like this. After activating Yin Tang, you may notice a sensation of heat or energy in your eyes, ears, face, or head. This is therapeutic, normal, and temporary. These 3 points are intended to reduce nervous system overload and allow you to more calmly face and handle the sources of stress in your life. Please feel free to comment below on any conditions you would like me to address in future videos. Till next time, this is Dr. Baritz signing off, yours for Health Naturally.
Well, that completes the bulk of our presentation. In this webinar, we covered basic definitions, stress and anxiety. We covered the roots of these words, getting an idea of how that means to be almost choked. I showcased the patient handout that you can give to patients either as physical handout or as a digital download. We looked at the supplements that I recommend and why I recommend them. We also took a look at 3 powerful acupuncture points for stress and anxiety. Is there anything, I'm going to answer any questions now, and I'm especially interested in answering anything that I can do to help you implement these points in this nutrition to help your patients. So Christine, do you have any questions?
Yes, there are a couple questions. Can you hear me okay?
perfectly.
Okay, excellent. So I'll do the Q&A first. The first in the Q&A is, what are the other 2 products you give every patient besides Simplex F or M?
I give black currant seed oil at a dose of 1 twice a day. That's strongly anti-inflammatory, and it's excellent for breast health. It contains gamma-linolenic acid, and there was a research study that showed that 30% of the breast cancer in the US could be prevented by taking gamma-linolenic acid. And so that turned the breast cancer world upside down, and everyone was on a search for good sources. As it turns out, black currant seed oil, I think, is in the top 3 sources. So that's my absolute next one. And after that, it's either Enzicor or Zypan. And Zypan, and I typically muscle test for that. But if you're not going to muscle test, I would select Zypan for anyone who's older than, say, 35, maybe Enzicor for anyone who's younger than 35.
Excellent, thank you. Next question in the Q&A is, what about Inositol tablets? Are they too expensive for the dose needed?
Much too expensive. You're going to be chomping down a bottle, in a couple of days. It's just not practical.
And I'm going to ask a question related to that Inositol myself. How high of a dose would you use for a child?
If a child is a teenager, they just get an adult dose, but you're going to titrate it up. If they're like a baby, or you might try a 1/4 teaspoon. If they're an infant, you might try like a 1/4 teaspoon, mix it in some milk. They're going to suck it down because it tastes so sweet. If they're a 1 or 2 year old, you start with either 1/2 teaspoon or teaspoons, and you titrate up. Top dose would be 3 teaspoons, and then just kind of manage your way up till they're about 13, and then they're ready for the full adult dose. Does that help?
Yep, perfect. Thank you.
Yeah.
All right, now over to the chat. There's a couple things in the chat. Okay, so I think we have a couple people commenting when you were talking about your acupressure with pets. Someone said that they would love to learn more about using these techniques on dogs. Someone else asked anything on relieving stress of a cat in heat. So I don't know if you want to answer that now or wait until you do a session.
Well, I simply will respond. I am going to do a full series after the start of the year, and if our series is going to end in a few more sessions, but if standard process or there's enough demand to re-engage, then I'll be happy to do the pet section with you.
All right, excellent, thank you.
And then let me get one quick thing. And if you happen to subscribe to my YouTube channel, you'll see the pet sections coming out anyhow. But in the webinar, I'll give the inside story.
Okay, perfect. Let's see. Okay, have you helped wean patients off SSRIs using Inositol?
Yes, and if this is a theoretical question, I say yes. If this is you have an actual patient in mind, I also say yes, but it is a complex issue because you cannot unprescribe Inositol unless you're a medical doctor or maybe a nurse practitioner. You can't control it. So you have to work, with the doctor on board. And, basically what I do, and there's a more in-depth protocol. I think we covered some of the protocol in the addiction section, and that's the protocol I would use. I would use Inositol along with it. And then in the addiction section, if you get a chance to watch it again, I think I talked about how to work with the medical doctor to make it happen.
Okay, excellent. And then to add to that, is it okay to use alongside anti-anxiety or antidepressants?
Yes, the beauty of it is you can use it right alongside them. And then if the patient is starting to do better, I encourage them to go back to their physician. I say, don't even bother, try to have the patient trying to inform the physician about Inositol. The patient merely has to say that, I'm feeling better now. I've improved my diet. I'd like to try to cut down. So it isn't a matter of trying to convert the physician. It's just a matter of for the person to get in contact with their physician. But you absolutely can use it alongside the antidepressant medications, and at least it may help them from getting elevated to another med, and at best it's going to help them reduce or eliminate it.
Excellent. And follow up to the black currant seed oil question, do you give that to men also?
Absolutely, because it's anti-inflammatory.
Wonderful. All right, and I believe that is it. I just wanted to mention one thing, Dr. Baritz. I'm not sure if you're aware that Standard Process is no longer making the Easy Magnesium stick packs.
Oh no! I wish I knew.
They changed it to tablets.
Really?
So yeah, I'm trying to think of how many months ago that change happened. So you can still get the Easy Magnesium, it's just in a tablet form. Because overall there was a lot of feedback from just a lot of people that the flavor of those stick packs, you either liked it or you didn't like it. So you can still get it. It's in tablet form, and the dose is 6 a day. The 6 a day equals how much was in one stick pack.
Thank you so much.
You're welcome. So you'll have to make that change. All right.
Yeah.
I think any other questions? I think I got them all in the Q&A. And I don't see any more in the chat, but it sounds like people are looking forward to anything on pets in the future. And thank you for all the wonderful information this evening.
Great. Thanks an awful lot. Great to be here with you. And I'm looking forward to next week.
Awesome. Excellent. Thank you, everybody, and have a great night.